The topic of discussion for this lecture is about kidney. In this topic, we will be discussing about what? A brief introduction about kidney. We'll be talking about its covering, its layer. We'll be talking about its blood supply, venous drainage, nerve supply. We'll be talking about what? We'll be talking about the relations of kidney. So these are the things that we'll be covering in this topic. The main thing that we'll be covering is we'll be talking about relations, right? Anterior relation, posterior relation. We'll be talking about the layers, the covering of kidney, and we'll be talking about what we'll be talking about and the knob supply, blood supply of kidney. Okay, now without delay, let's move, right? Okay, now initially talking about the brief introduction about kidney. What is kidney? It is retroperitoneal organ, and talking about its extension, it is from T tubule to L3 vertebrae, right? T tubule to L3 vertebrae. Now, okay, now here, okay, this is our kidney, right? This is our kidney. Now here, if you see, you'll find that kidney is divided into what? This outer region, it is our renal cortex. Renal, the term renal is used for kidney, and the inner one, it is called renal medulla. So these are the two things, right? Now renal cortex, the structure present within this area, it is what is our renal cortex, and the inner area is our renal medulla, as you can see right here. Okay, now as you can see right here, okay, now the kidney consists of nephron, right? Now this whole structure that you are seeing right now, what is this whole structure? This structure present within our box, it is our nephron. Now what is this nephron? It is what? It is uriniferous tubules, right? It is uriniferous tubules. Now if you'll see right here, and if you'll just see, you'll find, okay, this is all our nephron. Now looking to our nephron, okay, what we'll see is, what is this? This is our Bowman capsule, right? Bowman's capsule. Now moving here, what is this? This is our PCT, proximal convoluted tubules, right? And here this whole structure, it is our what? It is our loop of Henle, right? This is our loop of Henle. Now here this upward region, it is our distal convoluted tubules, and this one is our what? Collecting duct. Okay, now our renal medulla, it consists of what? It consists of collecting duct. Okay, now what is this structure? This is the structure where there is formation of our urine, right? Formation of our urine. Okay, now as I've already mentioned, what is nephron? Nephron is our uriniferous tubule, right? It consists of Bowman capsule, proximal PCT, loop of Henle, distal convoluted tubules, collecting duct. That's all. Renal cortex, as I've already talked about this. Renal cortex is at the periphery. Yeah, that's right. Renal medulla is deeper. Renal medulla have collecting duct. Yes, we talked about these things. Now talking about what? Talking about the flow of urine, right? Talking about the flow of urine, what is going on is our collecting duct, right? The collecting duct will pass the urine to our renal papillae, as you can see right here, renal papillae, right? Renal papillae. Now this renal papillae, what it will do is, it will collect the urine to our minor calyx, and this minor calyx will collect it to our what? Major calyx. Okay, this will collect to our major calyx. Okay, now this major calyx, what it will do is, this major calyx will, okay, here we have what? Here we have collecting duct, right? Collecting duct. This collecting duct will, what it will do is, it will transfer the urine to our what? Renal papillae, and then to minor calyces, and then to major calyces, right? And then to major calyces. Okay, here collecting duct. Now what is the structure right here? The structure right here is our what? Minor calyces, right? Now right here is our what? It is our major calyces. Now what is this? This is our renal pelvis, right? What is this? This is our renal pelvis. What it will do? It will carry our urine to ureter. Okay. Now this is all about what? This is all about the urine flow, right? Okay, now moving further, what we have is, we have our discussion on the relation of kidney. Now talking about the anterior relation of kidney. Okay, right here, what we can see right here is, this is our right kidney, right? And this is our left kidney. Now initially, let us look toward the relation of right kidney. Now looking toward the relation of right kidney, what we have is, okay, talking about the relation of right kidney, as you can see, the first and foremost thing, as you right here, you can see adrenal gland, right? Suprarenal gland, right? Okay, we're talking about what? We're talking about this thing, this, right? This structure. Okay, now here the above structure is the first thing that we'll find here is the superiorly in anterior relation of right kidney, we'll find right what? Adrenal gland or right suprarenal gland. Now moving a bit lower, right, in lower region, what we'll find is, this is, okay, we have removed liver from here, but this is the area of liver. This is the area of liver. So what we'll find here is we'll find what the area of liver, simply liver. And if you remember, between liver and our what kidney there is area, and that is called what? That is called hepatoliver and hepatorenal pouch of Morrison, right? Hepatorenal pouch of Morrison, and that's the most what? That's the most dominant position of gastric content in supine position. And okay, now here another is our liver, right? In our what anatomy, in our anterior relation of right kidney. Okay, moving further, what we have is, you can see right here, right colic flexure, right colic flexure. You can see what you can see. You can see the structures of large intestine right here, and here you will find what? Right colic flexure. Okay, now this right colic flexure, it is also called what? It is also called hepatic flexure of colon, right? This is also called hepatic what? Flexure of colon, right? That is in relation, in anteriorly in relation with right kidney. That's all. Now here, okay, another thing that you can see is, what is this? This is our second part of duodenum. The second part of duodenum is also related to what? It is also related to our this right kidney. So here what we talked about what? The first one structure is our what? Right suprarenal gland. We talked about right kidney. We talked about right suprarenal gland. We talked about liver. We talked about right colic flexure. We talked about what? We talked about second part of duodenum. So these are the things that we need to discuss while talking about what? While talking about the anterior relation of right kidney. Okay, now okay, I would like to just take you toward this thing. Okay, anterior relation of right kidney, the same thing we'll be revising now. The upper part, what it consists of what? Adrenal cortex, right? The suprarenal gland, the liver, there was the area of liver, and that we are telling what? That we are telling that is what it is called. It is called hepatic area. So here you can see what? Adrenal cortex, right? Hepatic area you can see right here. Okay, now in upper part these two things were there. Now talking about in hilum, right? In this region what we'll find is, we'll find the opening of what? We'll find not opening, we'll find second part of duodenum. Yes, we have discussed about this thing also. Now in the lower part, what we'll see? In lower part we'll see what? Colic area, right? Colic area, jejunum, right? Jejunum. Okay, now peritoneally, talking about the covering, right? Peritoneally, the area that it covers is hepatic area and jejunal area, right? Jejunal area. Okay, now since we're talking about our this right kidney, let us move toward our what? Our left kidney. Now talking about our left kidney, this is the structure that we need to discuss. Okay, this is the structure that we need to discuss. Now here, if you'll see clearly, then the most superior one structure is our what? Superior structure is our similarly left suprarenal gland, right? Left adrenal gland. Now below to our left suprarenal gland, the thing that you'll see is, here you will find what? You will find the gastric areas. What you'll find? You'll find gastric area. Gastric area. Why you'll find gastric area? Because here there is the presence of stomach. That's why. In the case of right kidney, there was the area of liver, right? But in the case of left kidney, there is gastric area, the area of stomach. That's all. Now here, if you'll see, if you'll just come below, you will find some area of pancreas, right? You will find some structures of pancreas. But you'll just see carefully, you'll find that just here you'll find what? Our spleen, right? The spleen is also in relation with what? In relation with our left kidney. Okay, now we're talking about what? We're talking about pancreas. Now if you'll clearly see this pancreas, you'll find that the tail of pancreas, right? The tail of pancreas is in relation with the hilum of spleen. The hilum of spleen, not with left kidney. The left kidney, talking about in relation with left kidney, we have what? We have our the body of pancreas, some of the part of body of pancreas, not the tail. Tail is in relation with hilum of spleen, not of kidney, right? Okay, that is the important point. So we talked about what? We talked about left suprarenal gland, we talked about spleen, we talked about what? We talked about gastric area. Now talking about other thing, you can see here, what you can see? Similarly, you can see left colic flexure also right here, right? Left colic flexure. Okay, now left colic flexure. Now Okay, now talking about what, let us move toward this part. Now here, talking about anterior relation of left kidney, right? Yes, we talked about gastric area, we talked about splenic area, right? We talked about what, pancreatic area, body of pancreas. We talked about celiac area, and the most lower region, it consists of jejunal area. Okay, here the upper part, it consists of gastric area, that's right. Medially, suprarenal gland. Yes, suprarenal gland, they represent were somewhere like this, right? Suprarenal gland. Now talking about laterally, what we are finding? We are finding splenic area right here. Hilum of left kidney, what it was doing? It was being crossed by, hilum of left kidney was crossed by what? It was crossed by body of pancreas. What is this? This is our pancreas, right? Crossed by body of pancreas. Similarly, lower part, that means lower this region consists of what? Colic area and jejunal area. Now talking about peritoneally covered area, we have what? Gastric area, we have splenic area, we have jejunal area. That's all, right? These three areas. Now we talked about what? We talked about the anterior relation of both kidneys, right? Anterior relation of both kidneys. Now the same thing, right? The same thing, as you can see the impressions, right? Here you can see, okay, here it is showing, what it is showing is, what is this? This is our what? This is our right kidney, right? This is our left kidney. Now talking about right kidney, what we have is, we have what? The superior most structure, that is what? Supranolar gland, right? You can see hepatic surface, the area of liver. What we can see is, we have what? Here we have the hilum, right? Hilum is right here, right? Renal hilum. We have what? Here in this area, what we are finding? We are finding the area right colic flexor, right? Right colic flexor. This is the area of right colic flexor. Similarly, we have duodenum. The second part of duodenum is present right here. We have right ureter right here. Okay, now talking about the left one, we have left suprarenal gland, we have gastric surface, we have in here laterally we have splenic surface, right? We have what? We have pancreatic surface, which the body of pancreas, right, crosses the hilum of our left kidney. Similarly, we have descending colic surfaces, right? Okay, now this was about what? This was about talking about the impressions, right? What are the things that signifies the specific region or kidney. Now moving toward what? Moving toward posterior relation. Okay, we talked about anterior relations, I think it's clear now. Talking about posterior relation, since we have got idea about the anterior relation of kidney, now let us talk about the posterior relation of kidney. So now getting into the posterior relation of kidney, what we can see right here is, we have what? We have, this is our 9th rib. What is this? This is our 9th rib. This is our 10th rib, this is our 11th rib, and this is our 12th rib, right? This is the posterior relation of kidney, right? This is the posterior relation of kidney. And what is this? Sorry, this is, what is this? This is our what? This is our left kidney. What is this? This is our left kidney, and here this is our right kidney. Now if you just look carefully, then you will find that the left kidney has what? It has reached the level of 11th rib. But talking about our right kidney, it had touched only 12th number rib. It hasn't reached the 11th number rib. Now why it is so? It is so because this, what is this? This is our what? This is our left kidney. And this left kidney, what is going on here is, this left kidney, during the course of development, we know that the kidney are what? These are ascending upward in abdominal region, right? These are ascending upward in abdominal region. This is our right kidney. This is our right kidney. Now during the course of development, this right kidney has to face what? Liver. And since liver is dense organ, it is compact organ, so it cannot push liver upward so easily, because of which it end up being at just 12th number rib, right? 12th number rib. But now talking about what? Talking about our left kidney, what we have is, in left region we have our stomach, and stomach is not that dense organ. So what will happen is, this left kidney, it easily pushes our stomach upward, and it reaches what? It reaches the 11th number rib. That is why our left kidney, its position extends up to what? 11th number rib. But our right kidney, it just reaches 12th number rib. It does not go further upward. So okay, now let us look in this diagram. Now we're looking toward this diagram. As you can see, right, what is this? This is our left kidney and this is our right kidney. Since we're talking about the posterior surfaces. Now here the left kidney, it has gone up to 11th number rib, but the right kidney, it just ended up in 12th number rib. Now here let us talk about what? Let us talk about nerves related to kidney. Talking about nerves, there are three nerves that we need to talk, and the three nerves are our subcostal nerve, another is our iliohypogastric nerve, and another is ilioinguinal nerve. These are three nerves that we need to talk. Now this subcostal nerve, this is precisely present in 12th number rib. This nerve is present on 12th number rib, right? Now here the same story: subcostal nerve, iliohypogastric nerve, ilioinguinal nerve. These are the three nerves that we need to talk. Now talking about the three muscles that we need to know, the most medial one is our psoas major. Most medial muscle, and kidney lies posteriorly on the surface of our this psoas major muscle, right? This is our what? Psoas major muscle. Talking about another muscle, that is our quadratus lumborum. And another muscle that we need to know is our what? Our diaphragm. This is also what? This is also made up of tendons, right? So what is this? This is about our what? Three muscles and three nerve supplies. Now let us see right here. Okay, it is mentioning four muscle. Here we have transverse abdominis, mentioning of transverse abdominis also, and we'll be talking about transverse abdominis. We'll be talking about the covering of kidney just after some time later. One is our diaphragm, psoas major, the most medial one, quadratus lumborum. And talking about three nerves, we have subcostal nerve. Yes, we talked about subcostal nerve right here, present on 12th number rib. We have iliohypogastric nerve. We have ilioinguinal nerve, the most medial one. Yes, right now we are looking toward what? We are looking toward the posterior relation of kidney. Now moving further, now the thing that we will be discussing is, we'll be talking about what? We'll be talking about the covering of kidney. Now talking about the covering of kidney, what we have is, we can remember it as what? RPRP. Now what are these RPRP? The innermost, inside to outside is inside to outside. The innermost is our renal capsule. Similarly, we have perinephric fat, we have renal fascia, and we have paranephric fat. Now what is this renal capsule? The renal capsule is innermost covering, and it is called the true capsule, right? The renal capsule is the true capsule. It covers what? It covers entire kidney. It is fibrous layer that covers entire kidney, renal sinus, and pelvises. You can see right here our renal capsule. Now moving a bit outer, we have perinephric fat. Now what is this perinephric fat? This perinephric fat, it is adipose capsule. This perinephric fat is our adipose capsule. It is present deep to renal fascia, as we have seen. Now what will happen is, as it will get dissolved during the time of prolonged starvation, kidney falls down. That means it is the structure that will hold kidney, and this falling down of kidney is called nephroptosis. Okay, this is about what? Perinephric fat. Now moving a bit outer, we have renal fascia. Now this renal fascia is also called what? This renal fascia is also called false fascia. It is also called false fascia? Yes, we talked about false fascia or false capsule. We talked about true capsule as a renal capsule, but this renal fascia is our false capsule. F from false and F from fascia. Now here, what will happen is, this renal fascia is a bit complicated since it consists of two layers, the anterior layer and the posterior layer. The anterior layer is also called the fascia gyrata. Anterior layer is also called the fascia gyrata, and the posterior layer is also called Zucker candle. The posterior layer is also called the fascia of Zucker candle. Okay. Now here what will happen is this. Okay, here as we are talking about what? we're talking about renal fascia, right? The lower region of renal fascia, they are not connected with each other. You can see what is this. This is our anterior surface of renal fascia. As you can see in this diagram, it is more clear. In this diagram, as you can see, what is this? This is our kidney, right? This is the anterior layer of what? Renal fascia. This is the posterior layer of renal fascia. Now this inferior region will not be connected, but the superior, right? The superior region of these two layers, anterior and posterior layer of renal fascia, will communicate with each other, and what they will do is they will just surround what? They will surround the suprarenal gland, forming by communicating with what? Suspensory ligament. And further, what they will do is they will continue as diaphragmatic fascia. Okay, this was about what? This was about our what? This was about renal fascia. Okay, now moving further. Okay, as you can see in this diagram, what is this? This is the anterior layer of, okay, another one important point is that this anterior layer of renal fascia, and what is this? This is our transverse section. This was our what? Sagittal section, right? Okay, these two sections were our sagittal section when we are cutting our body vertically, but this is what? This is our transverse section. We are cutting body transversely. Okay, now while cutting body transversely, what we have is we have anterior layer right here and posterior layer right here, right? Okay, as you can see, what is this? This is our medial and this is our lateral region. As you can see, vertebrae right here. Okay, now here, this is our anterior layer of renal fascia. This is posterior layer of renal fascia. These two, anterior layer and posterior layer of renal fascia, they combine and they form what? Canal fascia. What they will form? They will form canal fascia. Okay, now talking about the final one, that is pararenal fat. Now what is this pararenal fat? This pararenal fat, it is the outermost region. It is the outermost fat region, right? That is present, as you can see right here. Okay, this was about what? This was about covering. We talked about what? We talked about the innermost one, renal capsule. That's the true capsule. Talking about the outer to it, it is perinephric fat. And then we talked about renal fascia in detail. In renal fascia, we talked about anterior layer, that's called fascia gyrata. We talked about posterior layer, that is called fascia Zucker-Candle, right? And we talked that inferiorly they don't connect, but superiorly they will connect, and they will just cover our supranolar gland, and then they will just form diaphragmatic fascia. Okay, now talking about the blood supply of kidney, what we have is there is our renal artery. Now this renal artery is lateral branch of abdominal aorta, right? The lateral branch of abdominal aorta, that is renal artery, is divided into anterior segmental and posterior segmental. There are altogether 5 segmental arteries. You can see the anterior segmental consists of 4: superior, anterior, inferior, and we have posterior segmental artery. So total 5 segmental artery are there for the blood supply of kidney. Talking about venous drainage, the right suprarenal vein drain into inferior vena cava, whereas the left suprarenal vein drain into left renal vein. Okay, now talking about the nerve supply is through renal plexus, that is a branch of sciatic plexus. Okay, now the important thing are Brodell's line. And what is this Brodell's line? It is a vascular line situated between anterior and posterior segmental artery, right? What we discussed right here. There is one line that is a vascular line, and that is what we call Brodell's line. A vascular line present in between anterior and posterior segmental artery. Now, why it's important is that it is used to make incision while removing renal calculus. Okay, talking about renal angle. What is renal angle? The angle between tubal thread and erector spinae muscle, right? And what is its important? It consists of what? Kidney. It contains kidney. Talking about vertebrocostal angle, vertebro, right? That is our vertebra, and costal, that is our tubal thread. Angle between tubal thread and vertebra, that is our vertebrocostal angle, and its important is that its content is the lower part of pleural sac. Now, since we're talking about what? Supranolar glands, the glands that are present on the superior surface of our kidney, and they are right suprarenal and left suprarenal. There is quite difference in their geometry. The right suprarenal gland, it is triangular in shape, whereas the left suprarenal gland, it is concentric semilunar shaped. Okay, Now this was about what? This was about kidney. So with it, we came to end of the discussion, and this much for kidney. Thank you and have a great time.